Study designs in pharmacoepidemiology, quasi-experiment. Part 1. Learning objectives. Understand the basic concept of quasi-experiment design. Identify major differences from randomized clinical trials. Quasi-experimental studies encompass a broad range of non-randomized intervention studies. So let's go back a little bit and talk about the basic differences between randomized clinical trials and observational studies. In randomized clinical trials, we have intervention. We intervene with patient treatments. We assign patient randomly to intervention or placebo, or treatment A and treatment B. While in observational studies, we don't have any intervention. There is no intervention. We deal with real data. We deal with observational data. We only observe the data to obtain associations and conclusions. However, quasi-experiment studies, you can think of it as hybrid system between observational and experimental studies or clinical trials. So in a quasi-experiment, there is an intervention. However, this intervention is not randomized, which make it under the umbrella of pharmacoepidemiological studies, or let's say not non-randomized clinical trials. So it's a hybrid system. So it's used when it's not logistically feasible or ethical to conduct randomized controlled trial. This type of study doesn't use randomization. That's why it's have a lot of weaknesses and bias, as we can see now. Examples. Look at this example. A hospital introduces a new order entry system for the pharmacy and wishes to study the impact of this intervention on the number of medication-related adverse events before and after the intervention. So what's similar between clinical trials and quasi-experiments is the intervention, pre and post comparisons. So we compare before the intervention and after the intervention, similar to clinical trials. However, this intervention occurred without randomization. It's already happening in the policy of the hospital. That's why now it's similar to observational studies. We are observing the policy that's occurring, not because we want to intervene. However, it's part of the policy of the hospital. An informatic technology group is introducing a pharmacy order entry system aimed at decreasing pharmacy costs. The intervention is implemented and pharmacy costs were compared before and after the intervention. What is quasi-experiments? Quasi-experiments are studies that aim to evaluate interventions but that don't use randomization, as we said, which make them weak. Similar to randomized trials, quasi-experiments aim to demonstrate causality between an intervention and an outcome. So the target is higher. We want to see that because of the intervention, we see improvement, so on and so forth. Quasi-experiment studies can use both pre-intervention and post-intervention measurement, as well as non-randomly selected control groups. We will see now different designs in the following sections. Now, why we can do randomization? Why sometimes we can do random assignment for the intervention? Ethical consideration. For example, you want to implement a new policy in the hospital. So it's unethical that you start to do this policy just for one ward in the hospital and don't do it for the other wards. This is unethical. Difficulty of randomizing subjects. It's very hard to randomize. Difficulty to randomize by location, by wards, as we said before, and small available sample size. We can't obtain sufficient power by random assignment. What are the threats of establishing causality when using quasi-experimental designs? The lack of randomization is the major weakness of the quasi-experimental study design. As you remember earlier, we said that the major strength of randomized clinical trial and why they are on the top of the pyramid of the medical evidence is the presence of randomization. So the absence of randomization in this design make it weak, and the associations identified in the Quasi experiment meet one important requirement of causality since the intervention precedes the measurement of the outcome. We will talk about causality later. One of the major important points about causality is temporality, which means that the exposure or the intervention occurs before the outcome, before measuring the outcome. So this is add to the strength of quasi-experiment. What are the threats to establishing causality when using quasi-experimental design? We said earlier that causality is very important in pharmacoepidemiology because we aim to connect a relationship between drug X and outcome, disease, for example. We hope that this relationship is causal because causal relationships are stronger than associations. So there is certain criteria for causality that we will study in further sections. However, quasi-experiments have certain flaws related to causality. The first one is the inability to sufficiently control for important confounding variables arises from the lack of randomization. And this is because of the lack of randomization. We said that RCT are so strong because randomization can solve all the confounding variables. Both teams are now, after randomization, they are comparable. However, we don't have the same issue in quasi-experiment. A variable is a confounding variable if it's associated with the exposure of interest and is also associated with the outcome of interest. The confounding variable leads to a situation where a causal association between a given exposure and outcome is observed as a result of the influence of the confounding variable. So it's a false relationship. For example, in a study aiming to demonstrate the introduction of pharmacy order entry system led to lower pharmacy cost, there are a number of important potential confounders you can think of. For example, severity of illness of the patient. Maybe this severely ill patients require more treatment and also more cost. Knowledge and experience of the software users. Other changes in hospital policy. All of these confounding variables may have differed in the pre-intervention and post-intervention time periods, which lead to different conclusions. Let's look at this example. This is a study, a real study, using Quasi-experiment. The title of this study, The Impact of an Antifungal Stewardship Intervention on Optimization of Candidemia Management. So the background says candidemia represent a leading cause of healthcare-associated bloodstream infections with significant morbidity and mortality. The objective of the study was to determine the impact of a one-time targeted candidemia intervention on time to initiation of adequate therapy compared to standard of care. So what they did is they used a quasi-experiment, evaluated a targeted candidemia intervention involving a single phone call to the primary team providing recommendation for the care. Daily follow-up was provided by infectious disease consultant. 2 time period were evaluated, pre-intervention and post-intervention. The primary endpoint was adequate antifungal therapy. And they continue with the study itself. So you can see there's an intervention. This is part of the policy of the hospital. This is a quasi-experiment. We compare pre and post treatments. In the next section, we will learn about different study designs using quasi-experimental study.